Most people who rush to the emergency room convinced they are having a heart attack are sent home with a completely different diagnosis. Not occasionally. More than half the time. That number alone should change the way you think about chest pain, because the real danger is not just assuming the worst, it is not knowing what else could be causing it. If you have ever felt a tightness in your chest, a pressure, a burning sensation, or a sharp stabbing pain, and immediately thought, this is it, then this video will give you something most people never get: a clear understanding of what may actually be happening inside your body and, more importantly, how to recognize the difference. Here is what almost nobody tells you. Your body is surprisingly poor at communicating where pain originates. The nerves that run through your chest do not always send a clear signal. They overlap, redirect sensations, and sometimes point to the wrong source entirely. As a result, pain that begins in your stomach or esophagus does not necessarily stay there. It can travel into the center of your chest, where your brain interprets it as a threat to your heart. That is not a flaw in your thinking. It is simply how your nervous system is wired. Once you understand that, chest pain begins to make much more sense. The most common cause of chest pain that is not related to the heart is acid reflux, specifically gastroesophageal reflux disease, or GERD. Most people think of heartburn as a mild inconvenience that appears after eating pizza or spicy food. However, when it becomes severe, it can create intense pressure in the center of the chest that feels remarkably similar to a cardiac event. Spicy foods, fatty meals, caffeine, alcohol, and eating a large meal shortly before bed can all trigger it. What makes this especially confusing is that lying down often makes it significantly worse. Many people wake up in the middle of the night with severe chest pain and become convinced that something is seriously wrong. In many cases, an antacid provides relief within 20 minutes. Yet most people never connect the two because nobody has explained that acid reflux can feel this intense. Acid reflux is actually one of the easier explanations. The second major cause of chest pain surprises many people and creates an enormous amount of unnecessary fear. Your chest wall is made up of muscles, tendons, and cartilage. You use these structures constantly whenever you breathe, move, or cough. Like any other part of the body, they can become strained, inflamed, or overworked. An intense workout, heavy lifting, or even persistent coughing from a cold or flu can irritate the muscles between the ribs or the cartilage that connects the ribs to the breastbone. The resulting pain can be sharp, worsen with movement or deep breathing, and feel genuinely alarming, especially when it occurs on the left side of the chest. This is known as musculoskeletal chest pain, and it is one of the most commonly misinterpreted sensations in medicine. Pressing on the areas can provide an important clue. If the pain becomes worse when you apply pressure, it is more likely to be related to muscles or cartilage. Heart-related pain typically does not respond to pressure in this way. Then there is the third cause, and this is where things become especially interesting because the source is not in the chest at all. Anxiety and emotional stress can create chest tightness so convincing and so intense that even experienced physicians cannot dismiss it without proper testing. During a panic attack, your heart rate increases, your breathing becomes shallow, your chest tightens, and your body releases a surge of adrenaline. Every one of those symptoms can resemble a cardiac emergency. What is actually happening is that your nervous system has activated a threat response, triggering a full physiological alarm throughout the body. Your chest becomes one of its primary targets. The connection between the mind and body is not simply an idea. It is a measurable physical process. The unfortunate reality is that worrying about a heart attack during an episode of chest pain can create more chest pain, which increases fear, which causes even greater tension. It becomes a self-reinforcing cycle that is both real and measurable. At this point, the question most people should be asking is simple. How can you tell the difference? The honest answer is that sometimes you cannot, and you should never rely on guesswork when your health is involved. However, there are important patterns worth recognizing. Heart-related chest pain often occurs in the center or left side of the chest and may spread into the left arm, jaw, or back. It is frequently accompanied by symptoms such as nausea, cold sweats, shortness of breath, or an overwhelming feeling that something is seriously wrong. Cardiologists often refer to this as a sense of doom. Patients may struggle to explain exactly what they are feeling, but they know they need immediate medical attention. That reaction is not an overreaction. It can be an important warning sign. Chest pain that is not related to the heart often behaves differently. It may last only a few seconds or minutes before disappearing completely. It may become worse when you press on the area, change position, or move in a certain way. It may improve after taking an antacid, a muscle relaxant, slowing your breathing, or simply resting and calming down. Those responses provide valuable clues. A heart attack does not typically improve because you relaxed. Heartburn often does. There are also two conditions that do not fit neatly into either category and are rarely discussed, which is exactly why they deserve attention. The first is pericarditis, which is inflammation of the sac surrounding the heart. The pain often becomes worse when lying down and improves when sitting up or leaning forward. Deep breathing may also intensify the discomfort. The second condition is pulmonary embolism, a blood clot in the lungs. This can initially resemble anxiety because it often causes a rapid heart rate, shortness of breath, and chest discomfort. However, it is a medical emergency. If your chest pain becomes noticeably worse when you inhale, that is a warning sign that requires immediate medical attention. A simple guideline can help. If the pain is severe enough to interfere with normal function, seek medical care. If it is located in the center or left side of the chest and is accompanied by nausea, cold sweats, or clammy skin, seek medical care. If something feels profoundly wrong and you cannot explain why, seek medical care. Emergency departments exist precisely for situations like these. You are not wasting anyone's time by getting evaluated. You are obtaining information that your body cannot provide on its own. If you are ultimately sent home with a diagnosis unrelated to the heart, that does not mean the experience is over. It means a different conversation is beginning. Musculoskeletal chest pain often improves with anti-inflammatory medications, warm compresses, and rest. GERD frequently responds well to medication and a few lifestyle changes, such as avoiding food within 3 hours of bedtime, reducing trigger foods, and losing weight when appropriate. Anxiety-related chest pain often improves with breathing exercises, therapy, stress management techniques, and sometimes medication. These are real physiological conditions with real solutions. They simply do not originate in the heart. What many people carry with them after an episode of chest pain is fear. Fear that it will happen again, fear that they will misinterpret it, fear that they will react too slowly or too quickly the next time. But fear often prevents people from understanding what is actually happening. Understanding is what breaks the cycle. Your chest is one of the most responsive and expressive areas of your body. It reacts to what you eat, how you move, how you breathe, and even how you feel emotionally. That is not a weakness. It is information. The goal is not to fear those signals. The goal is to learn how to interpret them.